Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Investigation of choice of different uh, diseases of the kidney. So, autosomal dominant polycystic kidney disease or retroperitoneal fibrosis, the investigation of choice is CT scan. Medullary sponge disease, the investigation of choice for the medullary sponge disease is intravenous pyelogram. Vesicourethral reflex, the investigation of choice is micturating cystourethropography. This is vesico-ureteral reflex. For vesico-ureteral reflex, the investigation of choice is micturating cystoureterography. Retrocaval ureter, the investigation of choice is MRI. Investigation of choice for pelvic junction obstruction is DTPA scan, the diethyl triamine pentacetic acid scan, which is a radioactive scan used for knowing the dynamic function of the kidney. Investigation of choice for renal structure or surface is dimercaptosuccinic acid scan.
thank you and thank you for watching.